I am Dr. Himanshu Verma. I am head of nephrology at Subject Hospital, Delhi. Today, on the occasion of World Hypertension Day, I wish to tell you some important tips how to measure your blood pressure. You should be aware of these important pointers because if the method of measuring the blood pressure is not correct, then it may lead to erroneous readings and patients may get false high or false low blood pressure reading. So cuff size is the most important point. The cuff size should be according to the age and weight of the patient. Means for the pediatric patient, a small cuff size is there, and for the adult patient, a larger cuff size is there. And if we don't use a appropriate cuff size, suppose we use a small cuff size for an adult patient, then in that case you can get 2 to 10 millimeters of mercury higher blood pressure. The second important point is your support. You should support your arm while measuring a blood pressure because unsupported arm leads to approximately 10 millimeters of mercury higher blood pressure. The third thing is that when you tie the cuff on your arm, there should not be any clothing in between. It depends upon the type of clothing that interferes with the arm and the blood pressure readings, and it can lead to 5 to 50 millimeter of mercury higher blood pressure depending upon the type of clothing that is present in between the arm and the blood pressure cuff. Never cross your legs while measuring the blood pressure because crossing the legs can lead to approximately 10 millimeters higher blood pressure. Support your legs and your back while measuring the blood pressure. An important thing is that whenever you measure your blood pressure, you should empty your bladder before measuring the blood pressure because if your bladder is full and you have an urge to urinate, the blood pressure can go 5 to 10 millimeters higher. The most important thing is that whenever you measure your blood pressure, you should be in a quiet place and you should not having any type of conversation or listening to music or doing any type of activity because these type of things causes a spurious rise in blood pressure readings of approximately 10 to 15 millimeters of mercury. So whenever you measure your blood pressure, you should be in a relaxing position, such as early in the morning when you wake up from the sleep, or in the night when you go to bed, when you are relaxed 15 to 20 minutes in the night, then you can measure your blood pressure. Because blood pressure is a continuous phenomena which is happening in our body, and it fluctuates with the activities that daily activities we are doing. So it should be measured in a relaxing position, and that is the baseline blood pressure, and that should be monitored. Now the other thing is that uh, how we can have a control of our blood pressure. For that, you should do have a exercise routine, daily exercise routine of 30 to 45 minutes in a day. You can do walking, yoga, you can go for weightlifting in the gym. So these are the activities. Other thing is that you should have a healthy diet which is less in salt, less in fats, high in fruits, fresh fruits, vegetables, and you should avoid smoking and alcohol. So these are few tips by which you can keep your blood pressure under control. But the important thing, the pointers that I told regarding the measurement of blood pressure are utmost important because once you are diagnosed as a hypertensive, you should take the medicine for a lifelong. So to avoid that, you should have a correct measurement of your blood pressure with these 7 important points that I've highlighted and keep your blood pressure under control and have a healthy life. Thank you.